My name is Gabriel. Okay, welcome to today's episode on Medics in Tech podcast. On behalf of everyone at Medics in Tech, I welcome you to this episode. So, on today's episode, I have an awesome guest. His name is Olalekan. We've connected on LinkedIn and we've been having lots of conversations there. And then looking at his bio, very impressed. I know we're going to have a lot to discuss around marketing, around UI, UX, around your work with in WASH, female empowerment, financial inclusion, your work with AC. I was involved with AC2 one way or the other before. It was an SR Richard
Oh,
project that I
nice.
did one time that they came to my center in Ocean State. Then
Nice.
COVID-19 pandemic, then you're doing your master's in Bournemouth. So there's a lot of things to explore. And I think on that very
Yeah, and I hope that you don't ask me all the questions in the world.
but yeah, I think the first thing is to ask you about yourself. So who are you?
Yeah, thank you. Like you said, my name is Lekan Oyekon, and I work at the junction of health tech and marketing communications. So that means that I tend to wear many hats depending on the project I'm working on, you know. So and that's an opportunity because it helps me to be able to meet people from different specialties, different walks of life, and that helps me to really, really improve the work I do. Yeah. So basically, that's who I am. I'm currently in the United Kingdom. I'm studying digital health. I've been working in digital health already, but I just decided that, you know what, let me just go and get a certification to it. So I'm studying digital health currently at Bournemouth University. Yeah.
Okay,
So
thank you
that's
so much.
basically, yeah.
Okay, so how did you arrive here from your undergrad? Can you just tell us a little bit about your story? Just to
Oh
know.
yeah. Yeah, that's a very interesting one because first off, I didn't know that there was anything called digital health. I also didn't know that there was anything called healthcare communications. I just knew that in my church, there was this woman who was like my teacher, teenager teacher. So she works in communications. And so I used to intern with her during the holidays. I'll just go to her office and work with her. She pay me some money, and she was very helpful in building my media skills. So it was while I was working with her that I saw that, oh, there's something called media, and I mean, it was very interesting. We go to do press release, we cover events, and I really liked it. So I was personally looking for a way to blend that with healthcare because I was studying human anatomy at the University of Ilorin. So I was looking for a way to blend it, but I didn't know. I thought it was not possible to merge communications and health because it was like arts and science. So I thought I was going to be the first in the world. But as I continued, I began to discover that okay, there's something called health communications, and I only found that out when I was doing my master's at Ibadan, at UCH. But I was studying a master's in public health, but with a focus on policy and management. So I then discovered that some people were doing health promotion and education, and that was more like health communication. So I was like, oh, okay, and that was just it for me. That's how I got to know. But then I then moved into product design, UI, UX, when I first got the opportunity to train at a place called Tuten. So Tuten introduced us to UI, UX, and I was very interested in bringing it into healthcare. And at that time, I was asking them as Tuten that, do they know if it can be used for health? But they didn't know. They didn't know. So I thought I was going to be the first to do it, or like maybe it was not existing. But 2 years or 3 years down the line, I began to see that, oh, there are digital products for healthcare. So I just went into it straight up. And then
Mhm.
that's how we've been at the field for a while. Yeah.
So can you tell us some of
Thank
those
you.
digital products so that we have a glimpse of what you're talking about?
Yeah. Take for example, it's possible that hospitals can have websites. They can have bespoke websites, which are websites that are specially designed for them based on their structure. It's possible for you to just get a generic website and then just do that and just put their name and just hook it up and just put it up. But standard hospitals would want to have a bespoke website. They could also have a telemedicine feature plugged into their website where you could talk to your doctor from the website. If they want, they could have an app where their own patients could just chat with their doctor, and get some advice and all of that. And standard medical procedures. Additionally, hospitals could decide to do some level of artificial intelligence or machine learning to automate their diagnosis using AI to improve on how they diagnose patients. Different things can be done really. Yeah. Recently we did a project for a center called Kia Kia Health, and we had them have a chatbot that young people could use to learn about menstruation and all of that. So you could ask the chatbot some questions, pre pre-planned or pre-programmed questions, for the chatbot to answer you and give you some information. Yeah. So we designed all of that for different centers and different hospitals. Yes.
Okay, that's very nice. So now let's talk about some of the challenges you've seen. I know you work quite across various states in Nigeria. So some of the challenges you've seen, and how do you see the digital solutions, especially the ones you've worked on, addressing some of these challenges in Nigeria?
And another is that when we talk about Nigeria, it's a different ballgame entirely. And I must say that since I got to do it into the UK, which is just 6 months ago, I've seen a lot of difference, first in the thinking, then in the way things are deployed. There's a lot of planning that goes into place. Nigeria has some of the best plans in the world, and that is the truth. I've seen some policy documents, I've seen some work plans, I've seen brilliant minds come up with a structure, but the execution is always the problem. You know, so just this thing that we have said we want to do, let's just go and do it in all fairness and honesty and sincerity.
Mm.
It's tough in Nigeria because there are a lot of vested interests and mindsets. But generally speaking, anyway, um, digital solutions helping Nigeria. I think that's not even the problem. If you call an average strategy person to come and look into part of the problems that we have in the sector and come up with ideas, you'll be amazed at the ideas that you hear, that can be done. But the major problem in Nigeria is about execution. Execution. Let's execute this thing in the right way. Let's execute this thing the correct way, the way it should be done. We find it hard to do that. So some digital solutions that we have, for example, recently Aproko Doctor posted a video of a health center in Lagos, in Nigeria. Sorry, he didn't mention the location in Nigeria, where the primary healthcare center was in a dilapidated state. It was so wonderful. It was so painful. When I use the word wonderful or oh, this is so awesome, it's just me trying not to speak bad, speak evil. It was so awesome, and we can, these are infrastructure issues, and then we can then leverage digital solutions to improve the quality of their work. But they have to have something in place, first of all. Digital solutions, unlike what many people think, digital solutions are there to augment or to improve on the quality of work that is already existing. If you don't have time, take for example, you already have an idea to talk to young people who are in tech and in healthcare, right? So you are simply leveraging this Zoom platform now to achieve that goal. You already have the idea already. So that's the thing. You already have something you want to do. If there was no Zoom, it's likely you maybe travel to those places with a video and all your gadgets and then have this discussion. Do you understand? That's exactly what we're talking about here. Because you already have an idea and then you are simply leveraging digital technology to get your idea done. But that's the challenge in Nigeria. Even the idea to do it in the first place, we are dragging. So I think that's just the challenge that we have in Nigeria. Thank you very much.
Speaking of Nigeria, right, there are lots of dialects, there are lots of dialects, there are lots of languages, there are lots of culture and everything. So how are you able to navigate these dynamics across in terms of strategically communicating to different areas of the country?
Oh yeah. So the idea for me is when you have a marketing communications project, all right, when you have a project that you want to do, the project has its scope, has what it wants to achieve. So I'll give you an example. Say we have a project, and we've had this kind of project before on Kia Health to get young people to register for sexual reproductive health and rights, all right, services. So you want to then tailor your communication based on your target audience. That's how you tailor your communication. So if you know that, I'll give you another example. This organization, Hasty Health Initiative, which Hasty Health Initiative was going to reach young people in the north to get them to subscribe to sexual reproductive health and rights services. You may know that there's only a little bit of data on what happens in the north when it comes to SRHR. They are very, very protective based on their culture, maybe the prevalent religion and all of that. So in order to achieve that, what we did was to get an influencer. So we got an influencer, this guy that acts on TV. He's on is it called Bollywood now or no?
Nollywood.
Honeywood. That's what they call
Okay.
the wood. The wood in the north is called Kannywood. Yeah. So Kannywood. So he's a very popular actor. So we just got a doctor to interact with him in Hausa language, and they did an Instagram live, and we had a lot of Hausa people joining on the Instagram live. Why? Because he's a celebrity in the north. So all the speaking was in Hausa language, and then he was just talking about. I mean, he was just talking about healthcare issues and all of that, interacting with a doctor. All right. So that way we were able to get the Northerners to, and because at the end of that we had about, I think, 42% rise in requests that came in, and most of them were written in Hausa language. The Allah, a lot of those things. So you then see that, oh, okay. So these are the things that you engage in communications. You want to know who your target audience is, and then leverage a strategy that will help you to get them to be able to do that. So that's how we address. If we have a job to do in Nigeria, like currently we have a job to do in Nigeria at my organization, Media for Health, and that's what we are doing. We're looking at who is the target audience, and then we are trying to reach them. We have a job to do currently in Warri for one of our clients. It would be funny for me to assume that I can handle Warri being a guy who lives in Lagos. Warri is a different dialect. In fact, Warri speaks pidgin in a different way, all of that. So if you want to achieve your goal, look for somebody that speaks the local language, that knows the way to go on the ground, and you bring in your strategy and your thinking to augment their work and achieve your results. That's just how we do it at my organization.
Okay. So now let's go to your UI UX aspect, the aspect of the work you
Okay.
do. So how do you ensure
Yeah.
that the products you work on, the designs you create, are user friendly and accessible to different population across the country, based on the digital literacy as well across a different population?
Okay, thank you. First of all, accessibility, accessibility, usability, all these are principles in design, in user interaction and user experience design. You cannot say your design is good if it's not accessible by especially the target population, you know. And your user interface has to augment what the people want to see or what people need to achieve. So take for example, you cannot design a cup and then the point where they hold it is also the point where the water will pour out from. How would they eventually drink it? How would they drink the water? So these are some of the principles that are already existing in user interface and user experience design. It's statutory, it's already existing,
Mhm.
you know. So, but in the context of developing or designing digital designs or digital solutions to implement in a place like Nigeria or for any project that you may have, really, I would say that unfortunately people are carried away with the idea of digital design, digital design, digital design. The
Mhm.
first thing first that is very, very important is that what's the most important thing we're trying to achieve? I'll give you an example. Do you know that WhatsApp can be a digital innovation that can transform this country?
Mhm.
WhatsApp. I
Mhm.
mean, people will now say, oh, let's design a solution, let's design a masterpiece. And like I said, in a place like Nigeria, they can, and with all due respect, I'm also in Nigeria, but in a place like Nigeria or in a corrupt system, let me not say in a place like Nigeria, if a system is corrupt, all right, they may decide to do that to just siphon money or just
Mhm.
do
Mhm.
some elephants in the room kind of project.
Mhm.
If in a rural community, women are dying from maybe childbirth because if they start to bleed, they have a belief that this is a good thing. That means that their child is growing. Meanwhile, that belief is wrong. Do you understand?
Mhm.
Instead of you to say, okay, we will now bring in $200 billion to do this, just create a WhatsApp group that gives them the correct, that they can ask questions. I'm bleeding. Should I stay or go? The person says,
Mhm.
please rush to the hospital now. Their life is saved. That's a digital intervention.
Mhm.
Do you understand? That's a digital intervention that is solving problems already. So it doesn't have to be a very big project. So in the line of designing solutions that can bring results,
Mhm.
less is more.
Yeah.
It's even a principle in design, less is more. The easiest way you can, if it's just WhatsApp, if it's just SMS, that you can just send an SMS text message and say,
Mhm.
please, what do I do? And the person says, come to my office now. And your life is saved. It's a digital intervention that is saving lives. So
Mhm.
yeah, that's just my opinion on
Yeah.
that. Thank you very much.
Yes, thank you. So it's not really about how techy it sounds, it's how much of a problem it
Yeah.
can solve. So basically,
Yes,
even
it's always about solving problems. Yeah.
not how big it looks. Because what if you design a website
Mm-hmm.
or design an app and the population you're even working with does not even have internet, So maybe an SMS that goes with a phone that is not even a smartphone would have been more appropriate for
Mm-hmm.
that population. Sometimes it's just about
Yes.
solving
In
the problem.
you
Mm,
know that in some of the most um remote areas in the world
mm,
where the challenges are very, very big, these guys may not even have a phone.
mm,
Or if they have a phone, it's one small tiny phone. They don't even save numbers.
mm,
Just everybody's number is written on a paper. They just type it there,
mm,
call you. You don't know who's calling you. Just to say hello. They tell you, come over here, do this. You just go there and do what you have to. So
mm,
if you are going to design something for that person, you design an app that has a bandwidth of how many gigabytes. Where would they start from? They just keep it somewhere. They'll appreciate you. It happens to some of the projects that we have in Nigeria. You see a project in a rural place, a very big hospital has been built by one foundation. They'll take pictures. The local government chairman will come and cut the rope. They'll do everything, and that's it. Once they have gone, they'll close that door. It may never be open again. It's,
okay.
it's time. Go all over the country. You will see those kind of stuff. It's been
Mm,
there. I've traveled to 32 states in Nigeria,
mm,
and I can tell you for a fact, I see a lot of those things. Big thing there, nobody's using it because they don't even know how to use
mm. They're not suitable for population. So let's talk about
it.
your current masters now. So based on
Okay.
the experience you've had studying in the UK, a master's in digital health, how will you describe the future of health for Nigeria? Um, I mean, where you've been for a while, and with the global north you've been part of. You start traveled across Nigeria, so you kind of understand. You have the
Yeah.
you have the understanding already of things. But now looking at what is happening up in the UK, and I know you are familiar with other countries as well. How would you describe the future
Yeah.
of health for Nigeria, digital health
I,
wise?
I must yeah, I must tell you the truth. It can only get better. One of the best things about Nigeria is that the opportunities are there.
Mm,
It's the willpower that we have to fight. It's the human factor that is affecting us. It's not our skill level or our interest.
mm,
People have been interested to do things and they have just had to bow out and just say, you know what, I'll leave this thing. I mean, part of the reasons why I just said, you know what, let me leave the country for now, come and do a master's and all of that, was that I lost my own dad, you know,
mm,
to a failed healthcare system,
mm,
to a challenging healthcare system. He literally died in my hands, and I was going to run crazy. I just had to say, you know what, let me just leave this country for a while, you know. So these are some of the things. But it can only get better, and that's the truth. Because there are challenges, then there can be opportunities, and then there can be success.
mm,
Our biggest challenge is ourselves, our own humanity in the
mm,
country.
mm,
Our personal idiosyncrasies affect our ability to do a good job simply because of how we think, how we feel that things should be done, you
mm.
know. And these are the challenges that we have. The average young person in Nigeria is not asking you to dash him money. Just give him an enabling environment where he can show his skills,
Right.
where he can show himself. He just wants to do stuff. He wants to build. He wants to try stuff. He wants to cause disruption. Just give him an environment. Don't dash him money. Give him a room where the internet speed is very, very okay and where he can try his best
Mm,
and leave him alone to try his best.
mm,
So that's what I would say. I would say that in the nearest future, the ideas are there for Nigeria. Execution is only what we need. I think I only get better really. I hope that we can have policies. I hope that we can no, not even that we can have policies. We have policies. We don't need more policies. Let's just get to work and build.
mm,
And let us allow those things that we're building to be. Let us do well for each other by building solid stuff and then allowing those things to thrive.
mm,
Let's not allow personal aggrandizement or corruption or personal taste for this is how I want things to be to cloud us. And really, it comes down to the people. Because I won't lie to you, like I said, digital solutions. I mean, since I got here, it's like water. Yeah,
mm,
I won't lie to you. Here in the UK, digital solution is just like water. Everybody is engaging it.
mm,
No matter who you are, the old woman has a phone. She goes to buy stuff. She takes her phone. She just taps her phone. Do you understand? She just tap her
mm,
phone. She has
mm,
paid. She
mm.
drops her phone. I mean, it's the easiest thing here. Nobody, it's not grand.
It's
Yeah,
not
that's
luxury.
how it's supposed to be. It's not luxury. It's not what you say. Oh, I'm doing something that nobody else has done for. No, it's very normal. You go to your class. There's no I am talking to you from the school library. I had to schedule and get a room for myself that I'll be here for about 1 hour. Lock the room so that I can be able to talk to you. I mean, if you can see my back, is the school library that I'm at. The system is working. The internet speed right now, I checked it before talking to you, was about 415 megabytes per second.
Wow.
So is normal. It's not. I don't have to think and say, oh my God, how will I? Do you understand? So the next question is, what would you like to build? Because everything you need is there. How far would you like to go? Do you understand? That's all. So that is exactly what we need in Nigeria.
Okay.
If we want to move forward, nobody should stop us. Allow us to build.
So let's talk about let's go to the last question now so that we can conclude. And I think maybe in the nearest future we can come again and discuss some of these things. So now let's say someone is out there maybe they just finished their undergrad as well, or maybe NYC or something, and they're looking at the kind of career path that you have, or I mean just to even listen to you speak on ideas and insights on how to transition in this direction of digital arts, product design, and communications as well. What would be your advice?
My advice is that they have to be sure that that's what they want to do. And once they're sure that that's what they want to do, and by saying that they should be sure, I mean, for someone like me, it boils down to prayers. I ask God, okay, is this how I should go? Please guide me, lead me. Once I'm sure and I have my spiritual conviction, I think the next thing is for them to put in hard work into it. There are different centers in Nigeria that teach these skills. A lot of centers teach UI, UX, coding, development, software development, all those things. A lot of centers teach it. I would advise that, and because not everybody that has the funds to travel. If you can travel, I think every young person should. It doesn't mean that they want to leave the country. I think every young person should just travel, get more insight and knowledge, and maybe come back to Nigeria if they want to. But I think that it's possible to try to gain that ground knowledge. YouTube is your friend. I mean, despite the fact that I already designed, I still go to YouTube a lot to see what's going on. How are people achieving this? When I'm editing a video and I want to do this kind of style and I'm not so sure of how to go about it, I go to YouTube. So YouTube is your friend. I mean, learn, and then be ready to do anything to get a foot in the door, first of all. I mean, the fact that you have been trained does not mean that you will quickly start working with the Googles of this world or the big organizations of this world. And sometimes the solution that you're trying to build, you are the solution that you're trying to build. So sometimes you have to look inward and then build something good for yourself and for your world. All right. Yeah. I think that those are the things I would say. Learn, get centers where you can learn, meet people to learn, check online, learn, build, iterate, and just grow, really. That's my advice.
Yeah, so thank you so much. I think that will be all for now. If you have any other thing you can
Thank
just add.
you.
Yeah, thank you so much.
Thank
It's
you so
nice.
much. Thank you. I think I'll just add that we are at a phase in our world where a lot of things are possible, and it's just for you to have that desire in your heart to go for it and fight for what you believe is yours, and may God help you.
Yeah, thank you so much. And I think I'll be
Thank you
in touch
so
with
much.
you. Thank you. Cheers, mate.
All
Yeah.
right, no problem. Have a good one. Bye.
I need to do. Bye. Yeah.